You might have heard some of the following scientific rumors about drug addiction and bipolar disorder. Maybe you've heard that weed triggers it, or that chronic alcohol abuse might actually be a subtype, a new form of bipolar. You might have heard that people with bipolar are just in general more vulnerable to addiction and use a lot of blow. So, which ones are actually backed up by the science and which ones are just myths? Today, I, a drug scientist, will explain the interaction between bipolar and drug use. Now, the first thing you need to understand about bipolar is that there are two different types. So bipolar 1 is typically bipolar that is characterized more by that mania side of things. So you have at least one episode of mania and you don't necessarily need to have a depressive symptom attached to it. Now, on the other side, you have bipolar 2, and that's more characterized by the depressive symptoms. So you have one or more episodes of depression, but you also have hypomania. So it is not that full level of being manic as you see with bipolar 1. It can just be lower levels of that mania. For both types, people are far more likely to use drugs, but bipolar 1 is about 10% more likely to use drugs than bipolar 2 in terms of like the general rates of use. So there's something about that mania that seems to be doing something here. What is it? We're not entirely sure. And if you have drug use issues with bipolar, that actually makes the disorder itself even worse. So it's typically linked to kind of more severity of the disorder, so more relapses. It's also linked to things like problems with treatment. So you're less likely to actually have adequate treatment for both bipolar and for the drug use issues. We also see that the comorbidity between substance use and bipolar is linked to more rapid cycling in bipolar disorder. So you're going kind of quickly between those manic and those depressive episodes. And we also see that it's linked to things like an increased likelihood of committing crimes. So there is a Swedish study that actually looked at this and found that bipolar patients were twice as likely to actually commit crimes in comparison to somebody without bipolar disorder. And that was basically all driven by that substance use issue. So drug use in people with bipolar is actually very problematic for them. So which drugs are people with bipolar more likely to use? Well, the top one is alcohol, and we're talking about 40% of people with bipolar also have a lifetime prevalence of things like alcohol use disorder. Number 2 is weed. Number 3 are going to be the stimulants like blow and speed. And maybe opioids, although I couldn't find as much about opioid use disorder as I could for the others. Yet, in general, people with bipolar are far more likely to use all drugs, but it seems like they kind of have their drugs of choice. And those are alcohol, weed, and blow. We also see that people with bipolar smoke cigarettes and use nicotine at much higher rates. We're talking about 2 to 3 times higher than the general population, which is about equal to, if just a little bit less than patients with schizophrenia, which is what I actually did my PhD on. Why do people with schizophrenia smoke so much more? We should be asking the same questions about bipolar disorder too. We also see that alcohol use is correlated with how long their depressive episodes last, and weed is correlated with how long the manic episodes last. And there's even more with that weed mania link. So we see that weed increases the likelihood and the duration of the manic episodes. So basically it puts people more at risk for developing their first episode of bipolar. Now, we're not entirely sure that this is causal now, although some studies are saying that it is, but we can't really run a good experiment on this because that's super unethical. You can't really just make people use drugs to be part of this group and then make people not use drugs and see how likely they are to develop bipolar. So it's hard to determine if it does actually cause things like the development of bipolar. We can look at things and say, hey, before they had the symptoms of bipolar, they started using weed. And so therefore, maybe that weed is causing that, but maybe they just didn't have symptoms that we were actually diagnosing at the time. Those are called kind of prodromal symptoms. So symptoms that appear before the actual symptoms of the disorder do. We're not entirely sure what this relationship is right now, but it should give people at least a little bit of pause. Now, people with bipolar give similar reasons as to why they're using drugs, as is common with people without bipolar. So they're giving reasons like they're just bored, which is kind of frightening to me as a reason for people to use drugs. They're trying to decrease their stress. They're trying to alleviate some of the symptoms of the disorders that they might have. They're trying to escape from reality. But with the bipolar, you see an additional reason, and that some people might be using drugs like blow to try to kind of induce that manic state. Because people with bipolar sometimes actually enjoy their states of mania. They feel grandiose and they can do anything and they have tons of energy and they want to start all the projects. If you've been in a depressive episode, that mania feels real good. And that's also why it's really hard to keep people who have bipolar on medication treatment because they typically will show less adherence to treatment than other disorders. Like on average in a year, about 50% of people with bipolar who started treatment will actually remain on that treatment. That's not a good statistic. A lot of people quit. And that's at least in some cases, because they enjoy that feeling of mania and those drugs are reducing that feeling. So people with bipolar are just potentially taking those drugs to try to make that feeling appear again. And they're using drugs that cause feelings similar to that mania, like blow. Now, here's the thing. It's incredibly hard to study drug use in bipolar disorder. First, the symptoms of the disorder look very similar to the symptoms of taking drugs. So that mania, that can be induced by drugs. Some of the memory problems, that can be induced by drugs. Some of the depression, also caused by drugs. So the disorder itself is kind of hard to like take away the symptoms of that versus the symptoms of drug use, which means that it's just very difficult to look into it all. And then you have problems like looking at treatments. So a lot of like the clinical trials for treatments, they want people who do not use drugs. And that's a very select group. Like there are tons of people with bipolar disorder who use drugs and they need to be studied too. So there are very few studies out there that are looking at these populations, and what they have doesn't really give us much. So we do see that valproate might work for things like alcohol use and other illicit drugs. And we do see that they're coming up with like new types of therapies. So kind of combining different types of therapies for people who have things like alcohol use. But we rarely study things like the nicotine use issues. We rarely study all of the drugs that people are using together. We primarily focus on things like alcohol. Then again, that drug use makes the symptoms of bipolar even worse. And then doing things like quitting nicotine. So if you say, okay, I don't want to smoke and I have a bipolar disorder, if you attempt to quit smoking, that can actually cause those bipolar symptoms to become worse and cause like more episodes to occur. So that it makes it even harder for you to quit smoking, which already is hard enough. And then are we actually studying bipolar disorder? Are we studying something that is caused by drug use? So there is a discussion among scientists where they think that just drinking alcohol chronically can induce basically a subtype of bipolar disorder, like a brand new type. So yes, people with bipolar disorder do use drugs at much higher levels. It could be because disorders are actually prompting drug use. It could be because drug use is prompting disorders. We're not entirely sure right now, but it's really hard to study. So as a scientist, I'm sorry to anyone who is suffering from both of these problems because we're trying, but it is very complicated and we're not getting as far as we would like.